Well, like you just heard in that report, Tel Aviv is offering free of charge COVID vaccines for foreign nationals, specifically focusing on an outreach campaign for African asylum seekers and foreign caregivers. Finally extending the national vaccine campaign to those residing in Israel but without an Israeli passport. Let's speak with Osman Ali, project coordinator for the African Students Organization. Thank you so much for joining me today.
Thank you very much, first of all, and I am really happy to be with you, and thank you for the opportunity for the refugees and asylum seekers who have been suffering for such a long time about fighting this pandemic. Now is the time that they can have chance to be vaccinated. I think one of the biggest problems that we have faced since 2005 until today, it's about that people do not have papers, or they don't have proper documents to be covered by the health insurance, and that's one of the biggest issues that we have been fighting against.
So speaking of that lack of documents, what kind of documents do the people that want to come to get vaccinated need to provide to the clinic? Do they need to show some kind of documentation other than maybe a passport?
Well, according to the whatever we have from the Ministry of Interior is just a visa and some passport. But like there are a lot of refugees and asylum seekers they don't have actually a passport, or some of them they don't even have visa, and that may be one of the biggest challenges we are facing. But as a pandemic is something epidemic, people have to actually bring people to have. Even if they don't have those kind of documents, still they should be vaccinated as long as their fingerprint or name in it. But the problem here that we see is that the Ministry of Interior didn't put Ministry of Health actually didn't give us opportunity that everything going on is all about the language and Hebrew, whatever English, and a lot of refugees and asylum seekers that live in Israel, they don't understand Hebrew very well, or whatever English is so very well. So we as advocating on behalf of those refugees, we are the one who have to explain every day. And I know that Ministry of Health have employed a lot of people in terms of the communities to explain to them why what is going on with coronavirus. But in our community, there is no. So we are only people who are standing for our community, and almost like 0% that the rate of deaths in terms of position for human rights until now. There is no death cases for refugees and asylum seekers in front of coronavirus, and that is very well. I think this is the opportunity that a lot of people should go, and we are actually encouraging them to go and talking to them day and night with our own languages, with our cultural ways. It is not easy. It's not easy. It is a global thing, and we need actually help from Ministry of Health to pay attention in these things, because even if you vaccinated Israeli society and you didn't vaccinate refugees or asylum seekers, they are still living in the same community, and this is contagious disease. It is really, really important to pay attention on that.
Of course, a very important initiative, and anyone that can get vaccinated should absolutely go out there and get that vaccine. Osman Ali, thank you so much for your input.
You're welcome.